Are you a woman in your mid to late 40s and all of a sudden you feel like your mind and your body are betraying you? If this is you, you're likely one of the multitudes of women going through perimenopause. Unfortunately, perimenopause and menopause are too often ignored in our society. Women are told it's a natural process and just push through it, you'll be fine. So many of my patients feel like no one understands what they're going through. And all of a sudden, your bodies and your minds feel very different than they did before, and you just want to feel back to normal. If you're a woman who is going through this, let me validate you by telling you that yes, what you're going through is natural and normal. However, for many women, it's entirely unpleasant, and there is help for you. In this video, we're going to discuss what perimenopause is, what the symptoms are, and how to treat it. We're going to discuss menopause in a different video, so make sure to stay tuned. And remember, if you're liking this content, make sure to like this video, subscribe to my channel, and learn more about pregnancy and women's health in the future. So what is perimenopause? Most people have heard of the word menopause, but many people haven't heard the word perimenopause, and if they have, they don't really know what it means. Perimenopause is the time period leading up to when a woman goes through menopause, which is when their period stops for a year, and then it lasts for the year after they stop their period. The average age of menopause is 52, and for most people, perimenopause is in their mid to late 40s. Although for some women, perimenopause can start as early as their early 40s, and for some, their late 30s, although this is rare. The symptoms of perimenopause, which we'll discuss next, are due to fluctuating estrogen levels. Once women have their first menstrual period, their estrogen levels do this throughout the day. And when a woman goes through perimenopause, their estrogen levels do this throughout the day. It's these bottoming out of estrogen levels that cause the perimenopause symptoms. The drops in estrogen most commonly cause what we call vasomotor symptoms, which are hot flashes and night sweats. But the drops in estrogen can also cause a whole lot of other symptoms. I once had a patient tell me that she found a list on the internet and she had 23 of 26 perimenopause symptoms. Now let me be very clear, there is no set 26 symptoms associated with perimenopause medically. And while I love to blame a lot of things on perimenopause, I can't blame everything on perimenopause. Some of the symptoms I do blame on perimenopause are things like period irregularities, i.e. skipping your periods, having more frequent periods, having heavier bleeding, having lighter bleeding. Quick side note, if you are having heavy and frequent periods, you should definitely get checked out by your healthcare provider. Women also often have vaginal dryness. Estrogen is what lubricates and moisturizes women's vaginas, and so the drop off in estrogen actually makes vaginas dry, which can lead to painful intercourse. Many women also tell me they have a hard time sleeping, they have brain fog, they have fatigue, their mood is all over the place, they might have joint pain. There are lots of associated perimenopause symptoms. Unfortunately, women are often seeking answers and wanting to blame perimenopause, and perimenopause may not be the culprit for their symptoms. For example, some women have headaches and dizziness, and they can't explain why, and they think it's due to fluctuating hormone levels. And while sometimes that's the case, sometimes it's not. So I just want to caution you, don't blame everything on perimenopause, and if you're having symptoms you're concerned about, make sure to get them checked out. If you're having symptoms related to perimenopause, make sure to mention them in the comments. There may be other women out there who are having similar symptoms, and while they may be rare, they may be related to perimenopause. Before we go into the treatments that are available, let me first mention that there is no blood test that can tell you whether or not you are in perimenopause. Perimenopause is a diagnosis based on symptoms, and many women come into my office and ask me if I can check their hormone levels and tell them if they're in perimenopause. And the quick answer is, sure, I can check your hormone levels. But the long answer is, there's nothing that's going to tell me if you're in perimenopause other than the symptoms that you're having. Sometimes hormone checking can be helpful, but for perimenopause, it's simply not helpful. Speaking of treatments, let's talk about what's out there. And then you can go and talk to your healthcare provider about what might be right for you. As I mentioned before, there are a lot of symptoms associated with perimenopause, and all of these are due to fluctuating estrogen levels. But But some women have different profiles of symptoms, and some women have different goals of therapy. To be clear, some women don't ever have symptoms, and some women don't actually need treatment. For the most part, as a natural process of aging, perimenopause doesn't actually need treatment. However, I would argue that treating perimenopause typically improves quality of life, which is an overall aspect of health. When our estrogen is fluctuating throughout the day, the easiest way to fix this is to replace estrogen and to make it more stable throughout the day. For some women, depending on your symptoms and your period profile, it may be as easy as putting you on a low-dose birth control pill. For many women, this corrects the imbalance of estrogen and either significantly improves or completely removes those pesky perimenopause symptoms. For some women, we may want to go directly into hormone replacement therapy, or HRT. This is primarily used with postmenopausal women, but sometimes we use it with perimenopausal women as well. We will discuss that more in the menopause video. But for now, suffice it to say that using low doses of estrogen, either in pills, patches, rings, or creams may actually improve a woman's symptoms. Now, if you have a uterus, you will also need to take progesterone because that's going to protect against endometrial or uterine cancer. But maybe you don't like the idea of using estrogen and you want to treat your symptoms with supplements. There are many supplements out there, but before I go into them, remember, I'm not here to give you medical advice, and a lot of supplements can interact with medications or may not be safe for certain medical conditions. So if you're thinking about using supplements, make sure to talk to your healthcare provider. Some herbal supplements women use are black cohosh, red clover, ginseng, kava, evening primrose oil, and dong quai. I'm putting a link down in the description from the North American Menopause Society, which has a great page dedicated to these herbs. The NAMS website is a great website to keep in your back pocket. It has tons of information about perimenopause and menopause that many women I know find very helpful. And there's also a provider search where you can find a menopause provider in your area. Besides the supplements I've already listed, a lot of my patients use one called estrogen, which you can find at most grocery stores. And I also like the Bonafide website, which has lots of supplements that are tested and proven to help with hot flashes, vaginal dryness, libido, and mood disorder associated with perimenopause and menopause. Again, you can check the description. I'll leave the links there. You also may want to check out acupuncture if you don't want to use supplements or use hormones. Acupuncture can be very helpful at helping women regulate their hormone levels. If you only want to address vaginal dryness, vaginal estrogen is the key to your success. It comes in various forms, pills, creams, rings, etc. And most women have fairly immediate success with helping their symptoms. It's not a cure for vaginal dryness, however, and most women who use vaginal estrogen need to continue using maintenance dosing throughout their life to help with their dryness. I'm not going to lie to you, I hand out vaginal estrogen prescriptions like it's candy. It has very little contraindications because it's a very low dose and doesn't really get into your bloodstream as much as the other estrogens. So for people who can't use systemic estrogen, vaginal estrogen still may be an option. So if you're having a lot of vaginal dryness and you think you might want to try vaginal estrogen, make sure to talk to your healthcare provider. There is another supplement out there that's not estrogen called hyaluronic acid. Many women are used to using this for our skincare regimens, but women can also use it as a vaginal suppository to help with vaginal dryness. This can be helpful for people who can't use estrogen or don't want to use estrogen. Low libido is another very common menopause and perimenopause symptom. Low libido is also an extremely lengthy subject, and we're going to talk about it much more thoroughly in another video. Suffice it to say, libido is both hormonal and relational. And so when people come into my office and ask me to talk to them about their low libido, for the most part, we talk somewhat about supplementing estrogen and testosterone. However, a lot of women also need to talk about the things that are going on in their lives that may be affecting their libido relationally. As I mentioned before, period irregularities are very common in perimenopause. They're often very bothersome and they can happen for a variety of reasons. Some women have 5 fibroids, which are benign masses of connective tissue, and that can cause their irregularities. And some women have hormonal issues that are causing the irregularities. Period changes can be all over the map. And sometimes we treat them with hormonal birth control. The Mirena IUD is a crowd favorite amongst perimenopause women. And sometimes we need to evaluate the actual cause of the irregularities so we can address things like fibroids. If you've learned nothing else from this video, I hope you've learned that perimenopause is both normal and natural, and also fairly irksome for a lot of women. There are a lot of ways to help women with perimenopause symptoms, ranging from supplements to hormones to acupuncture. If you have questions or you want to share your story about your perimenopause experience, make sure to comment below. And remember, like this video and subscribe to my channel if you want to learn more about things like menopause and low libido in the future. Stay healthy, everybody.